Maat Probe Group, Sheffield presents its report on its 2009 monitoring exercise, Can You Accept the Truth? Maat Probe Group consists of African Caribbean mental health service users. They came together to support and represent African Caribbean mental health service users to understand their experience as mental health service users and to seek to expose and address the differences that African Caribbean service users experience in their daily lives. With the support of Open Up, a national project of Time to Change, they developed this first monitoring exercise as a learning and an empowerment exercise for its participants. It is a qualitative monitoring of the experiences of self-disclosed African Caribbean service users in the community. The participants include 63 African Caribbean service users from 5 different trusts. The questions were those that service users wanted to ask. No attempt at standardisation or representative sampling has been made. The first question was, have you ever felt you have been mistreated by mental health services? Initial response to this question showed a worrying number of African Caribbean service users felt they had been mistreated by mental health services, 56%.
We have to stand and say this is too high.
Further analysis include those who later reported aggressive restraint by mental health staff, show an even higher number of respondents feel they had been mistreated by mental health services, 63%.
How can a caring profession be happy with such high dissatisfaction?
If it's happened on other wards, there'd be an outcry.
Surely such mistreatment is breaking the law.
Mental health services should strive to provide a better service in hospital.
We further asked, was your mistreatment physical, mental or verbal? More than 1 out of 10 African Caribbean service users reported being physically or verbally abused by mental health services. Of those reported mistreatment, almost half reported physical or verbal abuse. Some reported multiple types of mistreatment. We need to ask, is it acceptable that people should feel this way?
I got verbal abuse when I was on the ward. They gave me tablets and got really overweight. They never listened to me and I was misunderstood because I'm dyslexic.
I was slapped by my support worker in hospital. I didn't feel I could do anything about it.
The medical is so high because they just don't talk. They sit in the office drinking coffee.
They do not understand black cultural ways of expression and see you as aggressive.
I was spoken down to and restrained against my will. Given medication against my will when I thought I didn't need it.
Just under half reported being restrained. 79% of those restrained felt it was aggressive. Just over 1/3 of those restrained experienced physical injury.
When I saw someone restrained, I found it very aggressive and disturbing. There was no need for 7 to 8 staff throwing themselves on a person.
Should people feel this way after discharge?
When I was discharged, they used some kind of hold-down aid.
Like a rugby team tackling a little old lady. A ridiculous amount of force.
Even after hospital, it is still with me.
Being discharged was like being tackled by the police. pinned down to the floor. I was restrained by having a knee in the back of my neck.
Feel violated.
Rape my mind.
Go in for recovery, come out injured.
Our next question. Were any of the mental health staff from your ethnic group? 57% of people said yes to this. That means over 4 out of 10 had no staff from their ethnic group.
This is a positive thing. We need more people to understand our culture.
As government reports show there is a high proportion of ethnic minority people in mental health services, surely we need to reflect that in our staff.
Black staff have a lot of claim, and this puts them under pressure.
77% of people reported having a mental health worker. Of those, just over 5 out of 10 had a mental health worker from their ethnic group.
I could have been better helped by people having more knowledge of mental health from an African Caribbean perspective.
Are there any benefits from having staff members from your ethnic group?
We need more support from black people.
Through work with healthy workers from my ethnic group, I have become more confident with a stronger sense of identity and belief in myself.
I could have been helped if, when interpreting, they took cultural differences into account.
I could have been better helped by people having more knowledge of mental health from an African Caribbean perspective. There are not enough ethnic doctors and nurses around.
When we asked, do you think your health worker is helping your recovery? Over 82% said yes.
I have learnt to cope better.
Most people were happier being treated out of hospital.
If you're in the community, you get better.
Over 82% said yes. Community mental health services seem to be something we are getting right. Can we build on that?
I'm very happy. They help me a lot.
Since being involved with mental health services, I talk to more people.
The service I receive could not be better.
Since being involved with mental health service, I am doing enough. They have helped me get out and do things.
Being involved with mental health services, I'm more active in society.
My mental health worker is not meeting my needs and messing with my benefit.
I keep going to their appointments and don't get out as much.
We asked, how do you feel you could have been better helped or supported? There were a number of suggestions, including staff actually listening and service user role models.
All service users becoming supporters or befrienders. Role models showing us how we can cope.
They could have met me halfway. I have a lack of trust. I lost it years ago.
I could have been helped better by having a person who had gone through this.
I could have been given more options.
Meds, better to stop me hearing voices.
I could have been better helped by offering alternative remedies, counselling, relaxation techniques.
We asked people, has your life changed because of your experiences of mental health services? Unfortunately, 62% of people either said their life had not changed or had changed negatively. A question that needs to be asked is, if the problem does not lie in the experience of community mental health services, where does it lie?
In conclusion, many might want to question the validity of this exercise. However, it cannot be denied that there is a sizable majority of African Caribbean service users who are dissatisfied with their perceived overall experience of mental health services. It is encouraging to find that the general feeling amongst African Caribbean mental health service users is very positive, particularly about their care in the community. It is a pity that for so many this positive experience is overshadowed by a very negative inpatient experience.
I am more reluctant to go into hospital.
You need to ask, can you accept the truth? The Maat Probe group now needs to ask, where next? Our answers include suggesting areas in our monitoring that could have been improved, distinguishing between male and female respondents, the inclusion of a control group from the white population, the refining of the last question so that we know if a person's life has changed for better or worse, questioning more people from a wider geographical area. It would be useful to see how other ethnic groups would respond. Further understanding of the effect of witnessing restraint rather than experiencing it would also be a useful exercise. Our recommendations. We call for an alternative to C&R used in resolving difficult situations on the ward, for example, respect, skip or Studio 3 training. We call for less dependence on medication and greater use of OT and talking therapies. We call for more ethnic staff. We call for a service user panel working alongside advocacy workers when complaints are made in hospital. We call for more promotion of SACMA in hospitals. We call for more training of staff by service users. We want to know why more respect and better treatment is afforded to African Caribbean service users in the community, in direct contrast with their experience of inpatient care. What have we gained from this? Many of us were told that because of our mental health, we could not make decisions and achieve for ourselves. We have seen through this monitoring exercise that we can. Many people have tried to stop us doing this monitoring exercise, saying it was too much for us. We have found we can do things. We don't need others to do them for us. This has given us back a sense of self-respect. We now have a network of African Caribbean service users elsewhere we can work with in the future. Is it acceptable the way African Caribbean inpatients are treated? We say no. Let's try respect.